Thank you very much. Okay. Yes, I am Maria Padilla. I'm the medical director of the Interstitial Lung Disease Program here at Sinai, and have devoted my life to the study of interstitial lung diseases, and in particularly pulmonary fibrosis. And I am delighted to be here. And I wasn't here for the early morning part, but without a breath, you can't beat. So lungs, heart, which one wins? Okay. Okay. So let's start because it is truly a pleasure to be here to talk about how the low dose CT scan is contributing to the early diagnosis of interstitial lung diseases, particularly the fibrotic diseases. How do we go from these, do I have, from the minimal changes that sometimes are called atelectasis, sometimes are called chronic changes, and nobody pays attention to them. And 5 years later, you see a patient who has well-established pulmonary fibrosis, and we miss that window to operate, to be able to alter these. Okay. Okay. So what are these fibrosing lung diseases? They include IPF, that you all know, progressive pulmonary fibrosis. Both prevalence and incidence of these diseases are increasing. They have a dismal prognosis. Their median survival is 3.8 years from the time of diagnosis. It compares unfavorably or favorably to some of the cancers for which we are putting a lot of effort into trying to make the earlier diagnosis. And so these diseases have a delay in diagnosis. There is about 2 years before the diagnosis of a fibrotic lung disease is made in our patients. These diseases also take a toll on our patients even before they come to the attention of our physicians. And there is a high comorbidity burden that accompanies these diseases. What we have to date are very limited therapeutic interventions for these diseases, and we can only apply it once the patient is fibrosed. So if you don't have the fibrosis well established, when you're not going to be able to change that outcome, you're not going to be able to apply these things. So we do need to change the paradigm of managing and diagnosing these diseases. And so we need earlier diagnosis, we need earlier intervention. Clinical trials are making a resurgence for this particular disease, and we are seeing that new therapeutic interventions are going to become available very soon for the management of these diseases. So we must suspect it, and we must utilize any of the tools that we have available. And what can be better than the low-dose CT scan? Okay, this is truly the gift that keeps on giving. Okay, and we know that there are many incidental findings in the CT scan that have helped us to understand a little bit about the course in the arc of the interstitial lung diseases. We start with those interstitial lung abnormalities that were defined by the Fleischner Society in 2020 as incidental findings on CT scans that were performed for reasons other than ILD. They are part of this spectrum of ILD that we have. They are the early precursors of pulmonary fibrosis, so that we do need to report these, and the physicians who get the report need to pay attention to these. And I think that's, I'll show you later, the European population in academic centers are truly ahead of us in this regard by having some panels that review these CT scans on these patients. So the other thing is that low-dose CT scan detects unrecognized ILD. So this is a golden opportunity for us to be able to look at these. So why are these ILAs so important? They are prevalent in the lung cancer screening population. They're prevalent in the general population. And in those patients who have at risk for development of ILD, either because they have a genetic a mutation or because they have a family history of ILD, the risk and the incidence and the prevalence in these patients is certainly much higher. We know that some ILAs, not all of them progress, but some progress to development of ILD over time. It may be 3, it may be 4, it may be 5 years, but they're heading that way. So, and we also know from all the studies that have been conducted that there are functional impairment in these subjects who have ILAs, and that they have overall increased mortality. So these are very important things that we should be looking at and making sure that if we had a crystal ball, we can determine that a minor changes that we see on these CT scans will eventually, in 5 years, become established disease. We don't have that yet, and we need to further study these. So what have we found about the low-dose CT scan when it comes to ILD? This was an early work that we did here with the group when we looked at these patients, and we discovered that unrecognized ILD was already present in low-dose CT scans. These are actionable diagnoses that we could have done something with, but we don't have as yet a well-established way to assessing them and to follow them or to evaluate them. Okay, and that's where the European people are way ahead of us. So this is the studies that looked at 1,800 subjects from the Brompton, and they found that if you classify an ILA as greater than 5% involvement, they detected it in 4.2% of their population. Those subjects were then evaluated and determined to have actual ILD disease, and those subjects were then referred to the ILD center and were treated. So the small amount of patients that ended up treated is small by comparison and percentage-wise, but it is a huge number when we talk about the many CT scans that we are performing. Okay, the same thing happened in the Yorkshire lung screening trial, where they did discover that the ILAs there were 2.5%, but they used a greater than 10% as the diagnostic criteria for reporting ILAs. And when they did that, they also found that there were patients who had, who were referred to the ILD center and who were diagnosed with the ILD and were treated for the ILD and at this point. And they also found that lung cancer in this population has a high percentage rate. So we talk about following our patients with fibrotic lung disease and getting CT scans on a yearly basis because we are looking for that cancer. When the cancer is very small, we can do something for the patient with ILD. When the cancer has progressed beyond the point where resection or intervention is not possible, it just adds more to the mortality of these patients. So with this, I want to thank all of you who participate in the low-dose CT scan programs across the world, because this is a CT scan that alerts us to the potential for ILD. It also unmasks ILD that is already unrecognized and allows us to be able to do the same thing that you do with everything. Disease-modifying interventions are going to be there. We may start appropriate interventions for those patients who are fibrotic or inflammatory. And we offer the opportunity to participate in research and trial participation. So, and with that, I think that we're going to see that the survival and outcomes of the patients with fibrotic lung disease is going to be better. So, thank you.